Thank you, John. First off, my chat thing is not working on my computer, so if somebody would go into chat to everybody and put in www.bestfriendsapproach.com. That is our speaker's website, in case you have questions for him after the meeting. David Troxell lives in Sacramento and has become nationally and internationally known for his writing and teaching in the fields of Alzheimer's disease and long-term care. He has co-authored with Virginia Bell 6 influential books, including his new book, The Best of Friends Approach to Dementia Care, and written numerous articles relating to dementia care and staff development and training. His areas of expertise includes best care practices for persons with dementia, caregiver support, staff training, and long-term care program development. Dave has also been a family caregiver supporting his mother, Dorothy, who passed away with Alzheimer's disease in 2008. You can read more about his work at the website that I mentioned. He's also on Facebook.com/Best Friends Approach. Thank you very much for being with us today, David, and I turn the meeting over to you.
Well, thank yeah, thank you very much, Bruce and gentlemen. It's great to be with you. I live in Sacramento, California, and like so many of us, it's been quite a year. But I feel so optimistic that we're coming out of this. But you know, Alzheimer's disease certainly is something that has been in the news because we know that people living with Alzheimer's have been disproportionately impacted by morbidity and mortality during this pandemic. And it's very interesting to think about this because, of course, many of them were people living in skilled nursing homes or assisted living memory care programs, but not all of them. And I think that the loss of life and the toll we've seen with Alzheimer's and dementia has been in part due to isolation and loneliness, which is something we're all struggling with. So I'm going to give a little update about Alzheimer's and talk about some of the dementias and a little bit about best practices, and hopefully have time for some Q&A. So I'll share my screen and go right to my PowerPoint. I guess if you can, Bruce, allow me to share my screen, you may have to give me that consent. Let's see, or make me the host, I guess it is.
I will. No, you need to go down to the lower share screen area.
Okay.
You have that on your computer?
Yep. All right, I'm hitting it.
Share screen.
Okay.
Can.
It says host disabled participant screen sharing. So if there's a way to allow me to share my screen, and if not, I'll just talk without my PowerPoint.
Let me share. I will try to let him share his screen.
Oh, you know what? Well, let's see, now you're recording it. Let me see if that's come on yet. Still not quite yet, Larry, but take your time.
All right, let me try another icon.
Larry, you can make him a temporary host as well.
Yeah, that's what I'm gonna make you co-host.
I don't know, that's a lot of power for me. I might hijack the whole meeting if you're not careful. All right.
You should
Let's see if that worked. It worked. Yay, well done.
All right, you're there.
All right, let me get to make sure I'm on the right presentation, and here we go. All right.
Yeah.
Oops,
Go
sorry.
to your, there you go.
Okay. Well, again, gentlemen, thank you for allowing me to present to your distinguished group today. And it's been quite a year with many, many webinars, but I've just enjoyed meeting so many new people and sharing a bit about my own work and what's new with Alzheimer's disease care. Today, I think I've packed a lot in for 20 or 30 minutes, but I'll try to stay on schedule. I'll just give a little bit of an update about Alzheimer's dementia, define some terms, talk a bit about kind of contemporary care. How do we help people who have cognitive loss lead a better life? I'll talk about a topic always near and dear to all of us these days, prevention. What is the latest research about preventing Alzheimer's or delaying the onset? say a few words about the pandemic, and then share some local resources. There's a lot to be proud of in California. And of course, the greater San Francisco Bay Area has so many really, really good resources I want you to know about. And then some Q&A. And my email, which will be in the chat box, is simply davidtroxell@gmail.com. I'm always happy to follow up with any of you individually by email or telephone and offer any advice or ideas I can offer. So I wanted to jump in with maybe some of the not so good news. I'm kind of the eternal optimist in my life, but I have to tell you, it's been a pretty rugged and tough 20 or 30 years. I've been working in this field since 1986 and started off at the University of Kentucky Alzheimer's Disease Research Center. And in so many ways in the last quarter century, we've come so far with our knowledge of dementia, the falling down of stigma, the advancing of services. But what has been stunning is that we've struggled to come up with a better medicine. In fact, it has now been, I think, almost 19 years since we've had a new FDA-approved drug for Alzheimer's disease. On the left, you'll see 3 drugs. Their trade names are Aricept, Exelon, and Razidine, very widely used. They kind of give the brain processing a little bit of a boost, but they don't truly stop the underlying dementia. The good news about these 3 drugs, they're called cholinesterase inhibitors. They kind of, again, give those neurotransmitters a boost. They're very, very low side effect profile. And there's a 4th drug called Namenda. It's an old German drug now approved for all 3 stages of dementia. And usually Namenda is given in combination with one of the first 3. But as you can see, Namenda itself wasn't approved. It was approved in 2003. And what are we in? 2021 now. Very tough. So we've struggled on the medical front to get a better medicine. I'm sure a few of you have read that there's a drug pending called aducanumab from Biogen. The FDA, it looked pretty promising, but then an outside review panel, candidly kind of trashed the drug. It's still under review. We will see, but I don't think it's going to be a miracle drug. It might help people a little bit in the early stages when identified early. But we need to do better. We need to do much, much better. Now, I don't have a slide on it, but I will share with you that the last I looked, there were about 190 active research studies in the US, over 32,000 people enrolled in clinical trials around the country. Of this 190, compounds, molecules, drug discoveries, a lot of innovation. And so as a friend of mine, colleague Jeff Cummings from formerly UCLA, now Cleveland Clinic, says he's never been more optimistic, in part because we have so much more funding for research. So stay tuned. I think we will have more drugs down the road. But for now, really, in many ways, the treatment is you and me and creating a therapeutic environment and doing our best to keep the person healthy. So let me take a minute or two and just tell you a bit about these various dementias. I do want to define my terms a little bit. The word dementia in and of itself is not a diagnosis. It's kind of a broad umbrella term. A good analogy might be thinking about the word soup, okay? You go to a restaurant, at least in the good old days, and you said, "Waiter, what is the soup of the day?" And he would say clam chowder or tomato. So think about it this way. Every clam chowder is a soup. Every tomato is a soup. Every mushroom is a soup, but not every soup is clam chowder. So think about word dementia, kind of like the word soup, a very broad category. If you go to your doctor and the doctor says your wife or partner has Alzheimer's or has dementia, pardon me, you want to say, "Doctor, what is the soup of the day? What kind of dementia?" So again, every Alzheimer's is a dementia, much like every soup, every tomato is a soup, etc. So that's a good sort of broad description about the word dementia. Again, Alzheimer's is one of the dementias. So Alzheimer's, we all know what it is. It's the #1 cause of dementia, probably about 60% of the cases. The average course of illness is about 8 years, but some people seem to go through the stages of Alzheimer's pretty fast and others more slow, even 20 years. Key symptoms include short-term memory loss, confusion, mistakes, delusion, fixed false ideas. And sadly, Alzheimer's is actually a fatal illness. It does shorten life because people with Alzheimer's are more prone to infection and falls, and even things like aspiration pneumonia with the swallowing reflexes and that kind of breakdown between brain and body. Behavior consequences. It's a myth that everybody with Alzheimer's is somehow combative or violent. They can be, but many are in good cheer. And as a caregiver, we don't have time to get into all the techniques today. You can learn a lot about how to kind of be with them, how to pivot, how to not question them and argue, keep them active, and then help them feel more safe, secure, and valued that can reduce some of these behaviors. So again, Alzheimer's, #1 cause of dementia. The second leading cause of dementia is vascular dementia. Very simply put, it's kind of like an interruption of blood flow to the brain. It's sometimes called multi-infarct dementia, stroke-related dementia. And you can have more than one dementia. A very common diagnosis is mixed dementia with vascular plus Alzheimer's disease. And, in many ways, vascular looks a lot like Alzheimer's, but there's some interesting contradictions. Some people with vascular dementia are very apathetic, and some are agitated. You can see this dementia on the scan, and early on, if someone develops and takes a heart-friendly diet and their blood pressure meds, blood thinners, you can sometimes slow this one down or have it plateau a little bit. Lewy body dementia is a really tough dementia, and it's the simplest way to put it is to think about kind of a combination between Parkinson's disease and dementia. People with Lewy body have some movement disorders, also forgetfulness. The telltale sign of Lewy body dementia, the most unique characteristic, is hallucination. And they are, you could see a visual hallucination like a big orange cat on the coffee table, but they can even be sounds and smells, okay? So again, this combination of Alzheimer's and Parkinson, movement disorders, hallucination, these people tend to be very sensitive about psychotropic or psychiatric meds, which we try to avoid in any case. And it can be a tough one. Now, I have a picture here you may recognize of Robin Williams, our wonderful California treasure, the comic who took his own life a few years ago. And you may be aware that after he died, the family actually revealed that he'd been suffering from Lewy body dementia, which puts kind of a new wrinkle on his suicide. He might have known what was ahead and decided that he didn't want to live with late-stage dementia. But also these hallucinations can be benign, and even, 3 little children you're talking to, that they can also be quite frightening. So again, Lewy body dementia. Frontal temporal dementia, frontal lobe dementia is a very interesting dementia. It's the only dementia that affects more men than women, and the peak age is 55 to 65. And simply put, as that frontal temporal lobes are involved, it causes personality change, even sometimes before it causes the memory loss. So that personality change can be there. Disinhibition, language issues. I kind of nickname this the me disease, someone who's very, very self-involved. And so this can be a tough one, but I will say that we learn how to manage it. When a client of mine in assisted living had a person with frontal lobe dementia who was a younger man with the dementia, they gave him a job, they gave him a title, they asked him his opinion, they gave him lots of praise. They were always sort of talking him up, and this seemed very therapeutic for him. And he actually did pretty well in memory care, thinking that he ran the joint when actually he was a resident, but this was their finesse in how to kind of manage this behavior. So it was very, very effective. I want you to know about something called mild cognitive impairment, which probably many of us have even on some of these tough days. But mild cognitive impairment, sort of simply put, is that you're having some problems with your memory that are sort of above and beyond the norm for someone your age. And when this memory loss is hitting you, it's actually rather disruptive. So you're making mistakes, things are going wrong. But the interesting thing about MCI is that you're actually doing pretty well with everything else. So if you look at my picture, it's a restaurant tab. Maybe someone with MCI can add up their check perfectly and put in their 18% tip. They can find their way to the restaurant. They can, park their car, get home. They're well groomed. But maybe 3 times during dinner, they say to their companion, now tell me, Mike, remind me, do you have any children? And then maybe 10 minutes later, do you have any children? And maybe 10 minutes later, do you have any children? So we think that over time, people who formerly have this MCI diagnosis, that they will develop full-fledged Alzheimer's disease. Now, what is really interesting, again, there's no medicines for these dementias that are truly impactful. I'll tell you in a minute about some of our approaches, but fascinatingly, do you know what a doctor might prescribe if someone has MCI? They might say, here's my prescription. I want you to live your life. I want you to sing in the church choir post-COVID. I want you to volunteer. I want you to eat well, exercise, enjoy time outdoors, hike, learn new things, and do everything you can to use your brain. We think that lifestyle might actually slow this down or perhaps delay the onset of full-fledged Alzheimer's disease. Now, if you have a family member who's been diagnosed with Alzheimer's, or if you yourself are having some problems, I will tell you that it's important to try to stay as healthy as you can. We know that people with Alzheimer's disease, when they're surrounded with good care, when maybe they're in a really nice retirement community or have a caring family, they do better. So you want to make sure that they're eating well. Sometimes someone with Alzheimer's might just eat a lot of sugar and maybe even drink. You want to make sure they have a good diet. Monitor their blood sugar. There's actually evidence that people with high blood sugar who don't control it, that is bad for the brain and may worsen cognition. Watch for depression. Very interesting. There's actually research dating back to 1952 that people with long histories of untreated clinical depression might be at a greater risk for developing cognitive illness later in life. Depression seems to be a fellow traveler to Alzheimer's disease. So if you suspect someone's depressed, you want to treat it with medication or interventions, lifestyle, because that again can drag the person down and have them perform at their worst, not their best. And maybe a little bit later in their dementia, pain becomes an issue, because you see, if I woke up tomorrow with a terrible toothache, I could call my dentist office and make an appointment and hopefully get my tooth dealt with. When somebody has Alzheimer's or one of the other dementias, you see they may wake up in the morning with a bad toothache, but not be able to connect the dots and tell their caregiver or family member, honey, I have a terrible toothache, I need to see a dentist. Instead, they're just living with that pain, which of course causes them to shut down, maybe even have some aggression, not eat, not do the things they'd like to do. So you always want to be a bit of a detective as a caregiver. And I already mentioned isolation and loneliness and how important it is to address those issues. I do a lot of consulting with organizations, and I remind them that there have been some powerful studies. One that came out several years ago that looked at how much individual attention people in skilled nursing centers get from the staff, particularly those people with dementia. Now, I'm not bashing the staff of nursing homes. They're so hardworking. They're really angels in so many ways. But the average person living in skilled nursing gets, if you back out the time you pass them the meds or give them a shower or help them, the average person gets 2 to 3 minutes a day of individualized attention, which is really heartbreaking. And so we want to do their best to keep the person mentally healthy and engaged, and that can again lift them up and have them be at their best. So I'll wind down my brief remarks today by talking a bit more about kind of how we help people with Alzheimer's disease or these other dementias lead a good life, and tell you a little bit about prevention and maybe a bit of coming out of COVID here. I will tell you that we believe that there's a lot we can do to be a good caregiver to people with dementia. And here's just a few simple strategies. Create a day filled with music, art, exercise, conversation, good food, time outdoors, and if you're in a facility, staff that smiles and show affection. Now, I'll break this down a little bit. Let me see if I have this next slide here. Music, I'll go back to the other one. One of my heroes and kind of mentors, or maybe not mentors, role models, was a neurologist who died a couple years ago, Oliver Sacks. Some of you may know him. He actually was the character in that movie and book Awakenings that Robin Williams played. He was a young physician, Oliver, working, I think, with a group of patients who had developed sleeping sickness encephalitis after World War I. Dr. Sachs gave them L-DOPA, and as you may remember from that movie with Robin Williams, they all kind of came back to life, at least for the moment. So he's a fascinating guy, a brilliant neurologist, a great writer, and he had a real interest in music and the brain. So Dr. Sachs writes that music can lift us out of depression or move us to tears. But for my many neurological patients, music is even more. It can provide access, even when no medication can, to movement, to speech, to life. For his patients, music is not a luxury, but a necessity. So if you are involved in caregiving, double down, triple down on music. You know, buy an Amazon or Google smart speaker where you can walk in the room and say, play Frank Sinatra, or play, you know, Dolly Parton, or play an opera. Music is very therapeutic and brings pleasure and joy. And if you have a person with dementia who's reluctant to take a shower, you put on some good music, they relax, and maybe the shower will go better. Now, if we go back to my previous slide, again, a few more things: exercise, conversation, good food, time outdoors, affection. Basically, you want to surround this person with friendship. This is a lot of my own writing and what I call the best friends approach to dementia care. It's very therapeutic, it's very healing. And if the person knows you and trusts you and likes you and is in a good space, everything goes better. So I'll talk about a couple more things here just to give you a little toolkit if you have friends or family who are caregivers. Exercise. It turns out that exercise is not only good for the body, but good for the brain. There's evidence that people who exercise regularly may get Alzheimer's disease later in life than people who don't. So again, if you have Alzheimer's, it might slow it down as well. So I recommend it twice a day. I think it's so important for all of us as we get older to do some little simple weightlifting if you can. There are these things called TheraBands you can get on the internet that are sort of stretchy bands you can use. Chair yoga exercise, walking. I've heard a few of you talking about hiking earlier. Very, very good. And people who are physically active, again, may get Alzheimer's disease later in life than people who aren't. Now, we all want to know about prevention. And I have to tell you, this has been a piece of good news for me, because, 10 years ago, we all hoped there would be a way to prevent Alzheimer's or delay the onset significantly. But many of the more serious scientists were kind of very skeptical and dismissive of some of these things. Well, guess what? More and more, we're getting behind these pieces. And in fact, we know already that actually the prevalence of Alzheimer's worldwide is dropping a little bit. We think in part because of, believe it or not, childhood education, the increasing of education for young people all over the world. It turns out that early childhood education might help us all build a cognitive reserve. Now, it's a bit too late for us on that score, so let me talk to you about a few other things. I mentioned exercise. Never too late to start. Exercise is good for the brain, good for the body. The Mediterranean diet, that diet rich in seafood, olive oil, vegetables, less red meat, less dairy, seems to be neuroprotective, and it's the only diet that I'm aware of that has been clinically shown to actually add to longevity. Now, you may not be willing to give up your In-N-Out burger quite yet, but I will say that, eating more vegetables and greens and berries, eating salmon a couple times a week, I think is very good for the brain. Social engagement. I want to commend you for all being in this particular club right now, because we also have some fascinating research that people who have friends, people who are socially engaged, people who volunteer, people who go to a faith community, people who have a boyfriend, girlfriend, husband, wife, or partner, they may get Alzheimer's disease later in life than the loners. Now, again, these are just risk factors. There are plenty of loners who never get Alzheimer's, but people who, again, enjoy company and socialization, that seems to be very neuroprotective. I think I've already said this once during this talk, but the brain loves company. And I think this is something good for you all to continue with. Lifelong learning. We don't really believe that, doing Sudoku and, doing these brain teasers will necessarily prevent Alzheimer's, but we do think there's some positives to staying active intellectually. A friend of mine who's a neuroscientist says we should all learn a new brain-rich skill every decade of our life. So again, very positive. Controlled blood sugar, I've mentioned. Good sleep hygiene. Good sleep is good for the brain. And the Alzheimer's Association says that what's good for the heart is good for the head. So watching your blood pressure, all of that, having a cardiovascular friendly lifestyle, very positive. And just so you don't think I'm a total downer telling you to exercise all day, it does turn out that a little bit of alcohol every day might be good for the brain. 1 or 2 ounces of red wine or even spirits. There seems to be some research out there that that can be very positive. So I'm happy to talk about that since we're in the middle of California's wine country in this whole area. Last couple slides here, and then I'll open the floor for Q&A. The pandemic's been so tough on our families, on people living with dementia. I'm so happy that better days are ahead. I will say that if you are a caregiver, we're still in this for a little bit longer. Learn all you can about caregiving and dementia. Knowledge is power. Things are opening up, the day programs, in-home services, retirement communities. I encourage you, if you are a caregiver, don't wait and wait and wait to use services. If there's a day program near you, take advantage of it. In-home help, or senior living, assisted living, memory care. I think when we get the help we need, it can make an enormous difference. You can have more fun time with your family member. And again, use of services provides our family members with more socialization. So again, services can help all of you who are care partners successfully travel the journey and provide important care and socialization for the person with dementia as well. So we're almost through here. The year ahead, interesting enough, there's some great research underway. I've already mentioned that the drug discovery pipeline is pretty robust. Lilly has a potentially interesting drug coming out that they might put an FDA approval in for, although it's just been tested in a small group so far. But I do think we're going to see more meds out there, increasing focus on minority populations. Alzheimer's disease seems to impact African Americans and Latinos at a higher rate than others. We want to understand more about that. A push for earlier diagnosis. We can now, using biomarkers, things like blood or saliva or spinal fluid, genetic testing, along with cognitive testing, we may be able to diagnose Alzheimer's when someone's 35 or 40. And maybe you're not going to have symptoms for 30 years, 40 years. Now, that could sound very scary and maybe not like a great idea, but we do believe that some of the drugs under development will have a much better benefit for you if you can get on them earlier. So earlier diagnosis might be important. And I think from a broad public health perspective and community perspective, we're going to be looking a lot more at dementia-friendly communities and trying to do more work within our communities to train everybody about Alzheimer's disease and dementia. So if you're driving along and you see a gentleman sitting on a park bench and he's there 2 or 3 hours later, we might pull over and find out what's happening and learn ways to make our communities much more accessible for people living with dementia. Again, I've been so blessed to meet people from all over the world. I thought I'd just end the talk today by sharing some wisdom with my friend, Dr. Nori Graham, who's a geropsychiatrist in London. She says, great dementia care in many ways is maybe not as hard as we make it out to be. It's all about informed love, which I think is very sweet. And I just want to share with you that, we're blessed in California. I mentioned it briefly, but a couple of years ago, I heard the amazing statistic that 10% of all human subject research on Alzheimer's disease in the world happens in California. We have something like 8 or 9 distinguished research centers. We have a terrific Alzheimer's Association based in San Jose. We have a statewide network of caregiver resource centers. And one of my favorites, which is Stanford VA, is very involved, but also the University of California, San Francisco, UCSF. Amazing center. The #1 recipient of federal funds for research is in San Francisco. Dr. Bruce Miller and his team are terrific. Both they and I believe Stanford VA has something called a memory disorder clinic that has a lot of great resources for everybody as well. There's my website, my Facebook page. If any of you are on Facebook, if you type in Best Friends Approach in the little search engine, you can like my Best Friends Approach, and I will I send out lots of articles and updates. And these are some of the books I've written. The little one in the corner, A Dignified Life, is my family book. It's very inexpensive. It's on Kindle and Amazon. And I do invite you to reach out to me personally, davidtroxell@gmail.com, if I can ever be of assistance. So thank you very much for letting me share this important topic with your team and with your wonderful club members. I'll toss it back to you, Bruce.
Thank you, David. Appreciate it. And a lot of information there. Do we have any questions from the group? Unmute yourself and ask your question.
Question, Dave. John Knapp here. Got a question on diet. If you eat nuts like peanuts or cashews or various nuts like that, is there any impact on Alzheimer's of having a somewhat nut-rich diet?
That's a great question. And I'm guessing that it's positive. It might depend on what nut you're eating. You know, I don't know enough about nutrition to know if certain nuts have better nutrition than others. I would say that probably you'd be better off eating raw or just roasted without the salt and oil would be very important. And I think that having that as part of your diet would be very, very positive. I'd have to do the research to know what is in each individual nut, like whether a hazelnut's better than a peanut or an almond. But I guess being in Sacramento, I will plug almonds. I think they are very healthy for you. And certainly, one thing I know is that often people can substitute that taste of nuts for even a sugar need. So I would say it's largely positive, everything in moderation. But you can maybe do some quick research about the vitamin content. Things that are rich in vitamin D, vitamin B, vitamin E, all of those are very positive.
Thank you, sir. I'll mute myself now.
A comment on that is if you look at YouTube and go to Dr. Mendel, he does talk about nuts and their benefits overall for health, but it does have other good side that may also affect our brain, and search the YouTube on that, and Dr. Mendel, and very interesting in this.
Thank you, Larry.
I will comment, I'm not a big fan of these memory supplements you see advertised on television. I'd much rather you save your money and get some fresh blueberries each week, and greens and leafy vegetables and some salmon, things like that. Because the problem with some of these supplements is we don't really know what's in them, and I think you'd be better off exercising and eating some good things from the farmer's market.
I think a good rule of thumb on that is if they finish off the ad, wait, call now and we'll give you twice as much. Then you know it's crap. I have a question about Lewy bodies. A friend of mine, we met when I was 12 and he was 10, and friends until he passed away last year. As he went through the dementia for about 6 or 7 years, it got to where he could not eat. He also had Parkinson's. He could not eat without getting terrible, terrible stomach aches and pains. And he went from 230 pounds down to 139 when he died. And is there any broadening explanation as to why this occurs?
With classic Lewy body, I wouldn't think that would be a normal symptom. So I'm guessing that he had some other disorder going on, or GI distress or disorder going on. Yeah, Parkinson's may be a bit more likely. I'm not a Parkinson's expert, so I don't really know, but I would hope that he'd gotten a really good workup to see what's going on. That's not a common situation. I will say that, there are people with dementia. We don't really understand why, but even though they're taking a lot of calories, they're still losing weight. We do see that. Part of it may be because of their agitation or pacing or other things. And then people will sometimes have swallowing issues, which can lead to aspiration pneumonia. And so there are people who stop eating or don't eat as much because they're having issues with swallowing. Of course, finger foods can be good. There are a lot of things you can do to get around that. And, you know, sadly, like even my mother, who did pretty well with her Alzheimer's, at a certain point, she really forgot how to use a fork and knife and would just, you know, eat with her fingers. And so we just tried to, you know, live with that by preparing finger foods for her and kind of protecting her dignity and keeping her diet going that way.
Thank you. Another curious part is that when I would visit him, he would not at times recognize his wife. But in none of my visits did he never failed to recognize who I was. And we could always talk about all of our times back together, childhood, teenage, etc. And thought that was strange.
The memory is very idiosyncratic, you know, and it's strange. Like someone with Alzheimer's will remember one son and not the other. They'll remember their poodle's name, but not their wife's name. I mean, it's really hard to understand sometimes why. And then it flips, you know, the next week they may like you and not like you. So that isn't really all that uncommon, because you see people with dementia, they kind of lose their sense of time and space. So they may think they're 40, not 80. And maybe they've known you longer than they have their wife. And there's something about your memory there that's still intact.
Thank you. Any other questions from the crowd? Unmute yourself, Freeman.
Does this do it?
That did it.
Okay. I heard on television 2 years back, in a very interesting study, jellyfish somehow seem to improve man's mind or some mind, and there's a pill out for that now. Is that deemed to be not good? Question.
Well, I'll put it to you this way. You know, right now, since we don't have other medicines, I've never wanted to totally dismiss something, but there is such a the federal level on overcoming this 20-year drought almost of medicines. But I have to tell you that they would move heaven and earth if anything truly looked promising. I'm guessing that, you know, that medicine on jellyfish, I've heard of it, that supplement really isn't worth the money. I wouldn't use it. If there's anything that will really help, I think the government actually act very quickly. You dig in deep, and you know, I'm being a bit facetious, but you'll discover that study on jellyfish was funded by the Jellyfish Association of America or something to promote the use of jellyfish or whatever. So I like I say, exercise, be social, come to these club meetings, and that's all probably a good prevention.
Yeah, I have a question.
Hey, Tom.
My wife is in the memory unit here at where we live. She is a sundowner. You familiar with that?
Yes.
As the day goes on, the worse she gets. What is the cause of that?
So, Tom, first of all, just let me tell you that I just recently wrote a short handout on sundowning for a client in St. Louis, Missouri. And if someone will send me your email or your regular mail, I'd be happy to send it to you.
Wonderful, thank you.
But I'll tell you that sundowning basically means that someone tends to get more agitated during the end of the day or late day. We think a lot of it is just general fatigue. But there are some things you can do, like build in some rituals, afternoon tea, rest, certain other things that can help. So perhaps, again, if someone will send me Tom's mail, Tom, either you or someone else, I'd be happy to share that with you. Tom, where do you live?
That's fine. If you would send that to us as the SIRS group, we will see that gets distributed, because
Okay.
I think there may be more than one interest in that.
I live at the terraces in Los Gatos.
I know that building very well.
Okay.
Wonderful place to live.
Ought to be.
Dave, question, John Knapp again. What effect does donating blood, plasma, red or white blood cells or platelets have on dementia, Alzheimer's, any of that?
Well, John, I have to confess that's a new one for me. I'm not aware that there's any impact on blood donation with the risk factor for dementia. So I'm sorry if I've missed that research, but I don't think there's any connection that I know of. Maybe there is, and I missed it. But I think you're perfectly safe to support that effort if that's what your question's about.
Yeah, thank you. I'm an active platelet donor, and I'm going to continue that until I can. Thank you.
I don't think you have any worries along that score.
Yeah, well, I do. I have Alzheimer's, but I don't have dementia or Alzheimer's yet. Larry?
Are there any other questions? Well, my wife is Italian, so I'm familiar with Italian dementia. That's where you forget everything but the grudges. Okay, well, David, thank you so much. We really appreciate you spending time with us, and good luck on other speaking engagements through SERS.
Okay, thanks, guys. Bye-bye. Take
you,
care.
Dave.
Bye.
Gentlemen, back to the meeting, and I thank you for your attention.